Hi, we are the Diabetes Nurse Service at the Queen Elizabeth University Hospital in Glasgow. I'm Victoria and I'm the team lead for the Diabetes Specialist Nurses. During your stay as an inpatient, you may see other members of the multidisciplinary team. These include consultants and registrars. Please be assured that all members of the team are highly skilled in their area of practice, and you will see the appropriate member of the team at varying times in your hospital stay. Due to the global pandemic, we may not be able to see you face to face. These videos have been prepared to help support you in your diabetes management, which may have changed recently. Please feel free to watch the videos as many times as you wish, and do share them with your friends and family who support you in your diabetes management. We will also refer you to the most appropriate service to support you when you leave hospital. This may be a community diabetes nurse, your GP, or another hospital diabetes service. This video today will provide education on insulin and injection technique. Insulin therapy is used to manage blood glucose levels. For a variety of reasons, it can only be given by injection. Due to your particular glucose levels, a decision has been reached by the diabetes multidisciplinary team that you require insulin. This may be for a short period of time, or it may be a long-term therapy that you require. Insulin can be taken at different times of the day, and your insulin pattern will be explained to you and included in your discharge letter from hospital. An electronic copy of your discharge letter will be sent to your GP, and this will let your GP know that you have commenced on insulin, and it will be added to your repeat prescription. The inpatient diabetes team will contact your GP to have any other items you require for your diabetes management added to your repeat prescription. You will be discharged from hospital with a supply of insulin. Insulin requires to be stored in your fridge between 2 to 8 degrees Celsius. So when you return home from hospital, please store your insulin in your fridge. Insulin is an injectable drug and will come in a pre-filled pen. These contain 300 units of insulin. This means they are reusable. Once you start to use an insulin pen, please remove it from the fridge 15 minutes before you use. And once out of the fridge, it should be stored at room temperature for up to 1 month. Remember, insulin should not be left in direct sunlight or near a heat source. If you are on a basal bolus insulin regime, this will mean that you have 2 different insulin pens. One will contain long-acting insulin, and the second will contain rapid-acting insulin. Both these insulins should be clear like water. You will be given leaflets on the insulin you have been prescribed. Please make sure you read these and understand what each insulin does. Remember, your discharge letter will contain how much insulin you should take and when you should take it. If the insulin you're taking is called Humulin M3 or has mix in the name, then this means that it contains both short and longer acting insulin. If you have a mixed insulin, then you require to combine the 2 insulins together. Before you remove the lid of the pen, please roll it back and forth in your hand 10 times, and then side to side like a seesaw 10 times. This ensures you get the correct ratio of insulin. Mixed insulins will always look milky or cloudy after they are properly combined. Please do not use an insulin that has not been prescribed or looks different from the insulin you have been taking. You must also check the use-by date that can be found on the side of the pen label. Insulin injections are called subcutaneous injections. This means the liquid is injected into the fat we store just beneath the skin. We tend to store this fat in the following areas: the abdominal area, also known as the tummy, the tops of our buttocks, the tops of our thighs, and at the upper back section of the arms. We recommend that you rotate your injection sites. This will help to prevent lipohypertrophy and allow insulin to be absorbed correctly. You will need your insulin pen and a 4mm needle to carry out an injection. I will now demonstrate how to carry out an injection. Please remove the lid of the insulin pen. This is where the insulin is contained. At the other end of the pen is the dial and plunger. Now we will attach the needle to the pen. Remove the paper from the needle case. Snap the end of the pen with the insulin into the needle. Screw the needle until it is tight and secure. Remove the large plastic outer cover, then remove the small plastic inner cover. We will now carry out a test shot to ensure that the needle and insulin pen are connected and working. Dial up 2 to 4 units of insulin. Push the plunger and look at the needle. You should see a small amount of liquid come from the needle. If you do not see any liquid, please repeat. If there is no insulin, then remove the needle and start again. Once you have seen insulin coming from the needle, please dial up your dose of insulin. For the purposes of this video, we will use 10 units as an example. Please select an area for injection. You do not need to pinch the skin. You only require to secure the surrounding skin like so. You should then gently insert the needle into your skin at a 90-degree angle. Push the plunger down to 0 and then remove your thumb or finger from the plunger. Now count to 10. Try not to move your hand and remember to breathe. Then remove the needle from your skin. As the needles are single use only, we now need to remove the needle from the pen. If you have a needle clip, please use this to remove the needle. If not, take the large plastic needle cover, place it on top of the needle, and now unscrew and remove it from the pen. When you start self-injecting, you may find that you bruise or bleed slightly. This is normal and will reduce as you develop your injection technique. Remember, if you require further support, your diabetes healthcare professional will be there to help.